Hello, good evening, and welcome to The Probe. My name is Carlos Caloni. We are live on 121 Go TV 125, all social media platforms. We are on Joy 99.7 FM, our partner stations across the country and around the world on myjoyonline.com. Tonight, we turn our attention to Ghana's mental health system. A system many experts say is now stretched to its breaking point. In 2012, Ghana passed the Mental Health Act with a promise of transforming mental health care, shifting to modern community-based care, protecting the rights of persons with mental illnesses, as well as establishing a mental health fund to ensure sustainable financing and more. But 13 years on, how much has truly changed? A 2020 World Health Organization assessment on this healthcare system offers a disturbing reality. 13% of Ghanaians live with a mental disorder, where 3% with severe conditions and 10% with mild to moderate illness. That means 1 in every Ghanaian needs mental health support. Yet in that same year, 2020, only 1.4% of the health ministry's expenditure actually went into the mental health fund. With the National Health Insurance Scheme still, excluding mental health services, thousands continue to face their crisis without any governmental support. So tonight here on The Probe, we ask the critical question: what has genuinely improved since Ghana began implementing the Mental Health Act? Our Joy News team has been tracking the state of mental health care delivery nationwide, and we've found out a few things which we'll be putting on your screens pretty shortly. But behind those statistics lie a silent epidemic: low awareness. Many Ghanaians insist they are fine, dismissing the need for screening or early intervention. We hit the street of Accra to test what the average Ghanaian knows about mental health and how to access help. Here's what they told us.
Mental health in general, I can say the disorderly manner of the brain. That's what I know.
I don't see myself to be, I don't see myself to be not normal. So I don't see the reason why I go to check my mental health. I'm a normal human being. Yeah, to me. Yes, of course.
I heard about it, but the meaning, actually, I don't know the meaning of mental health. Yeah, we have a hospital that maybe if you have a problem, you can go there and check about your mental health. Those who that their mind is not working well, that's the people that they can go there and check their mental health.
Well, first I might say you need to check it in the first place, and then also if you check it, it's for your own good, and no one would like to have a mental sickness. So when you check, actually for me, when I checked it, I realized I had no issue.
So mental health, the person is not really stable, yes, and acts abnormal. I don't really know the reason, but I know it's important to check.
Nowadays I can say that I don't know. I heard that, but I don't have anything can explain about that. If you think like you are okay, you will not go and check anything. Me, there, I think I'm okay. So I don't want to stress myself to go and check that things.
Well, those are the views of some Ghanaians on the street of Accra. But like I told you, Joy News research team has been tracking the real state of mental health care delivery in the country. And here's what they uncovered, which is there on your screen. And you can see that workforce of psychologists across the country, and workforce of psychologists like you see there on your screen, 49 government and other government hospitals across the country are just 49 nationwide. We'll find out why. Let's go on and see what the picture actually looks like. And the psychology ratio to population, you see in Ghana is 1 to 673,000, but WHO recommendation is that it should be 1 to 30,000, which means 1,100 more psychologists are needed to meet this global standard of 1 is to 30,000. Now, the psychology distribution by levels of care, if you look on the screen there, you see primary and secondary. We have just 12 psychologists in Ghana Health Service. That is at the primary and secondary level. If you go to the tertiary level, we have 37. Those are in teaching and specialist hospitals. This according to our research, Joy News research, and the sources from the Psychologists Association of Ghana. Let's continue to look at the distribution and break down the primary and secondary healthcare. There are about 6, which is about 50% psychologists in Greater Accra region alone. And 7 other regions have just 1 psychologist each. However, 9 regions do not have a single GHS psychologist. That's alarming. And so we want to find out why that's happening. If you go to the tertiary level, services are heavily concentrated in Greater Accra region. And there's no psychologist at all in the Tamale Teaching Hospital as we speak. Now, Ghana needs, or Ghanaians who need mental health, the figure is what you see on your screen. 5.5 million Ghanaians need to see or seek mental health care. That's the figure. And if we break that down, you see impact on children. About 2 million children in Ghana have mental problems. And out of them, 70% of them receive no intervention. Out of the 2 million, no intervention at all. Now, let's proceed to other key statistics. Now, 75% of mental disorders begin before age 24, while 50% of these show first symptom by age 14. And third leading cause of suicide for persons aged 15 to 29 in low middle income country, that is mental condition. And 1 in 5 women experience perinatal mental problems, with 50% not being identified. Now, the 2024, the NDC manifesto raised certain issues. They want to integrate mental health into primary health care delivery. They also want to establish a new mental health hospital in northern sector. They also intend to renovate and refurbish existing mental health hospital, that is Pantang and Accra Psychiatric Hospital. Now, still in that manifesto, they want to resource the Accra and then Pantang Psychiatric Hospital to enhance capacity. They also want to expand training, recruitment, retention of community mental health officers, as well as establish mental health hotlines under the National Health Insurance Scheme for e-counseling. All those have been captured in the NDC's manifesto. Now, let's look at budgetary allocation to mental health from 2020 all the way to 2026. And there you have on your screen, for those of you listening on radio, under 2020, the allocation to mental health stood around 15 million Ghana cedis. And in 2021, it dropped sharply to 3.75 million Ghana cedis. And then in 2022, it went up a bit to 6.25 million Ghana cedis. In 2023, it went down again to 4.5 million Ghana cedis. 2024, it went up a bit to 5.1 million Ghana cedis. However, in 2025 and 2026, allocation stood at 3.1 million Ghana cedis, the lowest from 2020 to 2026. Now, share of health sector budget trend. And you see there also on your screen, in 2020 it was about 32.22%, and that's the reflection you see there all the way to 2026, which is about 1.38%. Now, allocation to mental health for 2020 to 2026 period, mental health allocation has dropped by 79.3%. That's from 2020 to 2026. And across the 2021 to 2026 budget, mental health gets just 2.89% of total health sector allocation. This is what we found actually when we looked at the figures. Joy News Research has been looking into those. And the reason why we're having this conversation is to actually get answers and see what can be done to solve the challenge. And so joining me in studio is Dr. Richmond Akwa Coleman. He is the president, Ghana Psychological Association. And next seated to him is Dr. Ama Boedu. She is the Deputy Director General in charge of mental health, Ghana Health Service.
Deputy
Director. Thanks for the correction. And we also have Dr. Eugene Dodoi, the Chief Executive Officer of Mental Health Authority. When I return, we'll zoom straight into the conversation. You're still watching The Probe. Stay with us. Thank you so much for staying with us here on The Probe. Let me start with you, Dr. Eugene Dodoi. You are the Chief Executive Officer of the Mental Health Authority. What would you say is the one pressing challenge facing mental health care in the country?
Well, I mean, the challenge of mental health in developing countries or middle-income countries largely are the human resources, the funding. Even though you gave some figures, I don't think those figures are correct.
You don't think...
No, they are not correct.
These are figures...
3.1 million for the whole of mental health. Mm-hmm. That cannot be correct.
So what is the correct figure?
Because even for mental health authority alone, for 2026, the budget is about 8 million. For the 3 psych hospitals, they have about 20 million cities. And these are allocation for services. It excludes our salaries. And then it excludes all the services that Ghana Health Service provides in mental health. So that cannot be correct.
So what could be the correct figure?
I mean, unless you are able to, quantify how much goes into mental health from Ghana Health Service and add that to the one for the Mental Health Authority that owns the 3 psychiatric hospitals. And then you add our salaries because what you are quoting was
for specific mental health.
No.
That is expenditure from the Ghana Health Service allocated to deal with mental health issues.
No. So
not the entire budget to your department.
What you were quoting was the allocation 2025 for Mental Health Authority, just the agency. It's not so the agency regulate mental health service in the country and also provide mental health service through the psychiatric hospitals.
Does the ministry, Ghana Health Service, receive any other funding apart from that budget allocation to your authority?
The Mental Health Authority or the Ghana Health Service?
Ghana Health Service. Do you have a different budget from the Ghana Mental Health Authority?
Okay. So thank you very much.
We want to get a clarity.
Sure.
Yeah. So as far as I'm concerned, there is no specific budget for mental health for the Ghana Health Service. If there is going to be any budget for mental health services within the Ghana Health Service, it will be part of the, composite, for health service delivery within the Ghana Health Service. But there's none specific.
So that's what we've been tracking. So whatever Ghana Health Service is spending on mental health, that's what we've tracked.
No.
But I'm very interested in how you got this information. Yeah.
No,
I'm very much
that
interested.
information, I think I know the source. Because it was 3.1 million. That was the allocation for 2025 for the headquarters of Mental Health Authority.
Okay.
So that is what
that is not from the Ghana Health Service.
That is what government gives to the Ministry of Health to give to the authority for its work.
Okay.
And I'm saying that even when you talk about that, if even that was the only money given, that does not include the salaries of the staff.
Right.
And that obviously will be more than 3.1 million. And I'm saying that Ghana Health Service provides mental health care as part of health services. It will be difficult to track that amount that goes into mental health care because they are not giving money for mental health.
I think the clarity has been established.
Exactly. So those figures cannot be accurate.
Right. So from where you sit, I'll come to you. What is the biggest challenge apart from funding and human resource that you touched on?
Well, so if you take away funding the human resource, our next challenge is mental health illiteracy. Ghanaians don't understand what mental health is, so they don't even know when to seek help. Because people don't even understand that, okay, the fact that I am getting angry easily, I need help. So, and the same way we don't understand is the same way we kind of, should I say, minimize the need. For instance, Ghana Education Service train teachers to give counseling in schools. And they may have 1 or 2 teachers for a population of like 1,000 or 2,000 students. And those teachers, 2 of them or 1 of them, they teach normal classes and do the counseling part-time. I mean, how
that cannot be effective.
I mean, no, but the fact is that, I mean, it's like you think counseling thousands students, you don't need a dedicated person to do that job. It should be a teacher who has a regular teaching services and then add that. I mean, obviously, it tells you they don't even see the value of that. But like you said in the beginning, a lot of mental ill health starts when we are young.
Right.
And they are picked up by the teachers. And we have to help them in their schools. So it's quite unfortunate. And this comes from our collective illiteracy about what mental health is. So that also feeds into what we do, the policies and all that. And that is why, as an authority, we are currently embarking on a campaign to improve the mental health literacy.
To create more awareness?
Yeah. Even today, we had a Zoom meeting to talk about signs and symptoms of mental illnesses for the person in the community. We had people who have lived experience, who shared how they were diagnosed, and people who care for them, the caregiver. What do they go through? So we do this series to educate the people to know that these things are real, these things are illnesses, and these things can be treated. Because the good thing is that people can get help. We had one person who shared her story. She had a condition when she was in level 200 at Legon. She's currently a PhD student, candidate. And she talks about her struggles through the illnesses. But that did not stop her.
Right.
Yeah.
Okay, so we still have a challenge. Let me come to you, madam, Mr. Coleman. For 13 years of this new, act on mental health, what would you say has changed over the period?
Well, I think that we have made some improvements.
Right.
I'm happy that the CEO of Mental Health Authority has mentioned that there's a problem with mental health literacy and all that. But I must say that among the Gen Zs, they seem to appreciate mental health quite a bit compared to even the older ones. At least not to the level that we expect. Okay. But there's some appreciation that there's something called mental health, just that what to do, how to get it diagnosed and all that is where the issues may be. We've also, through that, of course, we have the mental health authority, or if you like, we have the Mental Health Act itself. Then we also have the Psychology Council. If you go to a place like Nigeria or whatever, other African countries, they don't even have a Psychology Council, but we have that. So we have made some kind of improvement. Like he mentioned, the only challenge we normally, apart from the fact that, and of course, there's also still stigma around though, but currently, some organizations or many organizations are also opening up to EAPs and support for their employees and all that. So there's some bit of appreciation when it comes to mental health, but we are still not there yet.
Right. Let's look at the human resource. Our research is pointing to the fact that in the entire of Ghana, we have just about 49 of psychologists or clinical psychologists in our health facilities. Why?
Well, you know, for me, what I would say is that I think that we have focused more on the biomedical approach. And so, for example, if you look at the chunk of our psychologists, they are normally in the teaching hospitals, maybe in some of the quasi-government hospitals. But at the Ghana Health Service, at the districts, regional levels, the local levels, you may not really see psychologists there. And so because we have focused...
Why are we not seeing psychologists there? Because there are Ghanaians there who also need mental health care.
I agree with you, yes. There are Ghanaians there who need mental health care. But the system has, over the years, not really employed more psychologists to go into those areas.
Who is supposed to employ the psychologists? Ghana Health Service?
Ghana Health Service is an employer. The teaching hospitals, they are on their own, so they come under the Ministry of Health. Mental Health Authority also employs psychologists within the various psychiatric hospitals too as well. So these are the three main employers when it comes to psych. And I think that one would expect that when it comes to the Ghana Health Service, they should even have more because they are more or less at the district and the regional level. So what it means is that normally some of the primary cases, secondary cases, they are often not really diagnosed or even treated. In fact, they are not even diagnosed at all. And of course, when it comes to the teaching hospitals, it is not easy to assess psychologists because, of course, you have to go there by referral and all that. So that is where the issue is. And I think that perhaps we need to know why. For me, we used to have quite a number, but they have left. They have left
the shores of the country?
Some have left, of course, they've gone outside to practice. Others too have left the system because the conditions of service is not good for them. Because a lot of our members who are in there and have moved either into private practice or they move into the universities to teach, they claim that where they have been placed is not just the best. So it is quite demoralizing for them to remain in the service. So a lot of them are not retained. In fact, you can't even retain them. Once they enter the system, they just leave because they think that when they compare themselves with
Is it about the benefits?
For example, you know, you need about 7 years to train as a psychologist. But when they enter the health system, they are placed as first degree holders, so 4 years. So a whole of 3 years is taken off. I think we have mentioned these things several times, that this is the problem, but nothing has been done about it.
Who is supposed to solve that challenge?
Of course, at the moment, it is between Ghana Health Service, in this case, and then Fair Wages. So Ghana Health Service is more or less our employer. So they have to really look at that and then speak to Fair Wages about it so that we can be reclassified and properly placed.
Okay.
To ensure
I'll come back to you. Let me go to Madam. She's smiling because she is supposed to be responding to many of these questions. So, first of all, we are talking about capacity and the fact that Ghana Health Service and the ministry or so should be employing a lot of the clinical psychologists. Are you doing that? What are the figures looking like?
Okay, so you put out a figure of 12 for the number of clinical psychologists in the Ghana Health Service. I must say that at the last count, I'm aware we have 19, which is still...
At which level? Because our 12 is at the primary and secondary level.
Yes, so yes. So the 19 that I'm talking about are at that level. Yes, primary and secondary. But that is still woefully inadequate because we need a lot more clinical psychologists to be able to provide the services that we provide. The next question is, why are we not employing them? Who is supposed to be employing them? Well, the Ghana Health Service and all other service delivery agencies. So the Ghana Health Service is not the only one, but actually is the largest. And so, like he rightly said, we would expect that we would have a lot more. Unfortunately for us, we need clearance from the ministry. So that's one challenge that we've had over the years, in the last few years. So in as much as a lot of them would prefer to be in academia or in some other corporate institutions, there are a few who still would want to be in the service. Unfortunately, we are unable to employ them because we do not have clearance for them. However, I'm quick to say that I think a lot has happened since 2012 with the acts. For me, I'm very optimistic. I tend to look at, rather saying that I have a half full glass rather than an empty one, because I think a lot has happened. I remember in 2013, we could actually count the number of psychiatrists in the country, but now we have a lot more. Then we were talking about just about 18 or something. But
so now we have 49. There's an improvement.
Oh, I'm even talking about psychiatrists.
Okay.
Yes, and we have a lot more. In fact,
what is the psychiatry figure as we speak today?
In fact, I have, my boss doesn't agree with me, but also some time back we were talking about 85, between 85 and then 90. Of course, there are some that are on retirement, but they still provide services. They support.
But still under 100?
Yes, still under 100. That is woefully inadequate.
For a population of 31 million plus?
We are more than 31 million.
No, I'm just asking, 32, 35, whatever.
All right, so when the law was passed, we had 1 psychiatrist to 2 million population.
Okay.
Currently,
that was in 2012.
Yeah, 2012. Currently, we are doing 1 psychiatrist to about 400,000 population. So there is an improvement, but we are not there yet. The recommended is 1 to 10,000. We are doing 400,000.
Why are we not there yet? Is it a funding issue, Ghana Health Service?
So I want to finish what I started, looking at how far we have come. Because I think a lot of time we tend to look at the picture as if it's so gloomy, but a lot has happened. So for instance, yes, in as much as we do not have, the specialists, especially within the Ghana Health Service, we have been training primary healthcare providers. These are ordinary medical officers, physician assistants, nurse prescribers, midwives, the different cadres of health professionals, so that these individuals are able to either identify, assess, manage, or just refer individuals appropriately, depending on their level of expertise. So in as much as we do not have, the specialists, as in the clinical psychologists and then the psychiatrists, we have a lot of mental health nurses as well. There are different cadres of mental health professionals within the Ghana Health Service and even in CHAG as well. And these ones are providing services. So one of the things that I am happy to talk about since 2012 is the fact that now you do not necessarily have to go into the psychiatric hospital to be able to access mental health care. You can walk into any health center, any health facility, and you are sure to get some form of mental health care, which is something we should be celebrating. Yes, because some years back, it wasn't so. And so we're building capacity of people. And in fact, it isn't just in Ghana. We can never have adequate numbers of specialists. And therefore, integrated care is the way to go. And that is why, for us as the Ghana Health Service, we're training our physician assistants and the other cadres, depending on their level of expertise, to be able to, one, identify and refer, 2, assess the individual, 3, manage, and where there's a difficulty, I mean, there are also pathways of referral so that people do not necessarily have to move patients, but rather even you were using, how do you call it, tele-psychiatry. You can actually call a psychiatrist and then would help you.
And Ghana Health Service is doing that?
We are doing that.
Yeah. What is the impact?
What is the impact? The impact, like I said, now you can access mental health care where you live.
No, I'm asking if this is helping reduce the number of mental conditions we are having. Yeah. Are we seeing any improvement? Are there any figures you can share with us?
It's quite interesting because this afternoon I was asking, that for so many years we've been quoting 98% as the mental health treatment cap, which means that only 2% of people who actually need mental health care are able to access it. We've been quoting this figure for how many years? And so much has been done. So I was asking my CE, what is the current figure? Yes. So a lot has, and he tells me that.
Of course, we need to be able to measure.
We need to be able to measure. Yes, so that is something that we need to do. But we cannot say we haven't, done anything or achieved anything since 2012. A lot has happened. We have invested so much. At a point, we didn't have issues with so much with the medications. But currently, as it is, in fact, we do not have, constant supply of medication. That is one of the major challenges that I wanted to bring up. I also want to say that he mentioned stigma. Stigma not just towards the individuals that have mental health challenges, but even for us as mental health professionals, we are also stigmatized, yes. And stigma is even within the healthcare system. So stigma is so huge. And it is something that we need to work at, and we are actually working at. It all comes back to, increasing public education, improving mental health literacy, as he mentioned. Yeah,
right.
That's very important.
Okay, so we'll look at funding. The Mental Health Fund has been established, and it's working. Tell us about the fund arrangement, how it's been able to impact mental health care in a country.
Yeah. So the law-established mental health fund, the fund has been established, the account is there, but it's not being funded. So it's just an empty fund. So one of the proposals we have is that if we can take what we call sin tax. So sin tax is excise duty on things like porn, betting, gaming, sweets, sugar, alcohol, tobacco, drugs. So if you take excise duty on these ones and you specifically put them for mental health, we believe this is going to improve funding for mental health. In fact, the recommendation is that it should be at least 5 to 10% of the health budget. And it's not in vacuum, because studies show that at least in Ghana, about 7% GDP is lost to mental distress. So we're not treating our people who have mental illnesses. Make us lose as much as 7% of our GDP. And if you think about it, wealth is not created because of your natural resources. Wealth is created because you use your mind. So if any population are not using their mind, that is why they are poor. A country like Singapore or Japan, they don't have natural resources, but they are rich because the human beings use their mind. So mental health is very important. In fact, you can actually use poverty as a proxy for the mental health status of any population. If you are poor, it actually means you are not mentally healthy. And that is in the definition of mental health, because you should be able to contribute to your society. If you're not contributing, you are not mentally healthy. It's very important that we invest in mental health. And we invest not only in the people to train, let's also invest in the resources. Currently, I mean, we are not looking at building psychiatric hospitals, even though there is one in Kumasi about 70% complete, and there is one in Tamale about 90% complete. But what we are looking at is like what Dr. Buadu said, every facility should be able to provide adequate quality mental health care. Say that the psych hospitals will only be a referral center for maybe very serious cases where we use that for training. But otherwise, for the day-to-day care for mental illnesses, it should be in every health facility. And people go there to seek health care, not like in a separate place. They just go there like somebody who has an injury, somebody who has a headache, somebody has a chest pain, somebody else. Yeah. So
is that a way to reduce the stigma? So I can walk into any facility just to check my mental health status or something?
In fact, it is a way to reduce the stigma, but the reality is that that is what it is. Formerly, when we didn't know how to treat mental illnesses, that is why we had the asylums.
Okay.
But now science has, taught us a lot. We know how to treat them. So they just go to the hospital like any other person, get their treatment, and they don't stay there. So they go back.
Right. Let's look at the numbers when it comes to mental health. I'll come to you shortly. We are talking as a country now, we want to get a clearer picture about, you said a lot of people, 7% of GDP has been affected.
Yeah.
What is the number when it comes to mental health from where you sit? You know, you can give us some figures.
You mean number of what?
Yeah, people with mental condition. We've already given you some figures here, but from where you sit, what is the picture looking like?
All right. So the challenge we have is that, like I said, we don't have mental health literacy. So we don't even diagnose them. But there are some conditions which are considered the same amount in every population. For instance, every adult population, 1% would have schizophrenia, which is about the most severe mental health disorder. About twice that number will have a bipolar. About twice that would also have something like a depression. For every 10 people, one of them will have substance use disorder. So if we are looking at this, we are virtually looking about, for the adult population, almost about 10% of us to 50% should have a serious mental disorder that need care.
10% of
yes. So if Ghana is about 35, and we have, let's say, about 10 million being the elderly and the children. So for those who are about 15 years to, old, they may be up to about 25 million, if we are about 35 million. If you take 10% out of that, that is 2.5 million of Ghanaians who are ill enough to seek care, who are ill enough that need an intervention. And when we look at this intervention, we should look at it in terms of productivity. So these 2.5 million people are not using their minds to make wealth for Ghana. And that is why we are poor.
How should we resource that fund? You touch on some...
syntax.
Yes, taxes and all that. Beyond that, what can be done? As you speak, you said that the fund is zero. There's nothing in there.
Yeah. The other approach is the fact that we take tax for healthcare, health insurance, which is more like a VAT. So, of course, we should now begin to devote a large amount of health insurance to pay for healthcare. Luckily, from next year, 4 conditions in mental health, which is schizophrenia, depressive disorder, bipolar, and anxiety. These are all going to be reimbursable from health insurance. So once we do that, that is also putting some money to pay for mental health care. And we are grateful that that is coming on board. We are hoping Oliver asks for more. There are going to be more conditions.
From next year, if a family member of mine has
bipolar or depression,
he or she can just walk,
go to any facility
with his national
with your health insurance card,
and
the hospital will get reimbursed.
Okay.
For seeing you with the bipolar.
That's good news, but that doesn't solve the entire problem, because the fund should be working to support people with serious conditions and all that. So let me come to you. You touched on many of your members leaving the country and all that. You are from the Ghana Psychological Association. In terms of capacity, we are losing it, right? What would you want to see policymakers do to ensure that your members get employed by the Ghana Health Service and the other services?
For me, I think that of course, Dr. Abuedu said something which I do not oppose to it. The fact that because we do not have psychologists at the primary, secondary level, they are training some primary health care.
So they are making you redundant.
At least to hold a
No, that is not what I meant. That's not what I meant. What I mean is that we can never have adequate numbers of specialists. And across the globe, especially in low and middle income countries. That is where there's that intervention to integrate mental health care, train primary health care providers to provide mental health care as part of their routine care. And as part of that, we know that when it comes to the management of mental health care conditions, you know, just as we're looking at etiology coming from the three-pronged approach, biomedical and then psychosocial. In the same way, when you have mental health challenges, the approach is the same for management. So the psychological intervention, there's the biological intervention, and the social intervention, depending on what the causes are. In fact, for a lot of people, we need the psychological and then social intervention most of the time. It is in very severe cases that you have to give medication. However, even when it comes to the psychosocial intervention, not to say that we do not need the specialist, but every health worker can be trained to provide the basics, which is very, very important.
So that is his concern, that they spend about 7 years or so.
Yeah, so that's what I was
I'm not
really understand the point.
Yes, I understand.
But
so what I'm saying is that, yes, we would want to employ so many specialists, okay? It's not even just psychiatrists and then
the
psychologists. We need speech therapists. We need, you know, social workers, a lot of them. However, the psychologist work, okay, is more like a specialist, you know, intervention. But there are basics that people can give. So I'm not saying because we are training people to be able to provide the basics, we shouldn't employ psychologists. No, that's not what I'm saying.
Let's give it a chance to, to make his point. Yeah.
So actually, I was actually not opposed to that arrangement for now, of course. And clearly, you can see that it's because of some constraint when it comes to funding, and that's why we are doing that. But the point is that, based on our regulation, even those that provide basic mental psychosocial support, they have to do that under some supervision by a specialist. So if you are even in a district hospital and you are providing those basic, you are not a psychologist. So who is ensuring that you are actually doing the right thing? That is where the issue is. And that's why it is worrying to know that we just have a few psychologists scattered across, and there are some places where you don't even have psychologists at all. Yet there are others that are providing some kind of psychosocial support. But how do we ensure? And that's why the question as to the impact. How do we even know the impact if they are not professional psychologists? So in as much government can do something to hold the situation, just to improvise or just a stopgap measure, we should try as much as possible. At least every facility, even if you have one or two across, because it's not about the issue where we don't have these, they are there. In fact, we are training about 1,000 psychologists almost every year or so. So we have enough of them. So we should be able to at least bring some into the system to handle the issues, because the issues are there: perinatal mental health issues, antenatal depression, postnatal depression. who is speaking out those things. So clearly you realize that, yes, some efforts are being made, at least at the primary level, just to screen some of these things, but it is not intentional.
Okay.
And I think that if we take mental health issues, and of course the three of us here are all mental health specialists. So once we take mental health issues seriously, we just have to be intentional about it and ensure that people that are providing are not just providing basic, but we are providing actual healthcare support. Perhaps, again, we'll come to the issue of funding, perhaps, but I think that it's been far too long. CEO mentioned that the money that you quoted was even
3.1
was small. In other words, the money is even more than that.
Okay.
So then the question is that if a lot more money is put into the system, do we make some available to employ, especially psychologists, into the system? Because a lot of the issues that happens at the primary and secondary level, like she rightly said, it is psychologists that must handle them, the psychosocial issues. But for me and for our members, we think that sometimes even our colleagues in the medical fraternity do not really appreciate the value of psychotherapy and some of these psychological interventions. So sometimes you might think that, oh, well, we can train any other cadre of what have you to do that. No.
So your association, you are more or less opposed to that approach?
No, we agree in principle as a stop.
But it's going against
But going forward, yes, this thing cannot continue. We need psychologists to be, so that we can actually test the impact of the services that we are providing. Because if psychologists are not there, how can we say that these things are working? Yes, it may work. I'm not saying it will not work. But there should be somebody to supervise and ensure that the right thing is.
I see Doc Wedu smiling a lot. Maybe she has an answer for us. As we wrap up the conversation, going forward, what should we see change when it comes to, the onboarding of specialists like this to ensure that the healthcare we receive at our hospitals are top-notch?
Can I
think?
come in?
Oh, okay, you can come in.
Sorry, You see, I think we should look at where we are coming from. Our health system has not changed much from what the colonialists left for us. We are still adopting an approach which is more curative. And the curative is largely based on what we call the biological model, meaning we should see a disease and take medicine to treat it. So that is how the whole health system is modeled. So over the years, every year, government employs doctors and nurses, but no other health cadre again. So they don't even engage the pharmacists every year. They don't engage the lab people every year. That is why they don't also engage the psychologists every year and the social workers. So it is not about psychologists. It's about the health system, which is only...
So policy must change.
Which is heavy on doctor, nurse. That is all that. So we have to kind of change the policy and see that health is not produced only by the doctors and the nurses. So that if we have this holistic idea, then the other cadres will come in. Because as he mentioned that we need psychologists, I'm surprised he didn't mention that we need the social workers. And as at now...
No, but he is a psychologist. So
as at now, social workers are employed at the local government. They're not even in the health sector at all. But social workers, I mean, we all agreed health is biology, psychology, social. Yeah. And yet, the whole chunk of social workers are not even in the health sector at all. So it is not something I would say maybe against psychologists. It's how, it's kind of the system we practice as a nation has not developed to meet the current needs of our population. And that is why, I mean, so even when it comes to mental health, it's skewed towards psychiatrists and mental health nurses, which shouldn't be so.
Okay.
But in the mind of people, mental health must be seen by a psychiatrist. Yeah. So that is where the challenge is. So we need a whole kind of like paradigm shift to address health as a whole. Even in Ghana, we don't even see health as even like a security risk. But health is security.
Okay.
But we don't see it that way.
Okay. At the Ghana Mental Health Authority, he wanted to know if you've been able to employ some psychologists or psychiatrists. I don't know.
Well, I think for all the agencies, maybe Mental Health Authority has the highest number of psychologists.
Oh, really?
Yeah, because we are the only agency that kind of, I would say, anytime that we can recruit, like we do recruit them.
Okay.
So we would have the highest number, but it's still not adequate at all.
Right. Finally, my interest is in measuring impact, because it appears you are doing a lot. Ghana Health Service, you're all doing your best, but we are unable to measure, indeed, if we are making progress, if we are still, or if we are retrogressing. So how do we address that challenge as experts? I'll throw it to you, Dr. Bodu.
How do we measure impact?
Yeah, how do we solve that problem of our inability to measure impact?
Okay, so I would say that when it comes to the healthcare system, like he did mention, is a system, and a system is made up of, so many components. Also, a system sometimes has to depend on other systems for us to be able to function properly. What I think, especially for us in mental health, I might be wrong, but I think that when it comes to our capacity in terms of research, I mean, it hasn't been top notch. It's in recent times that, we started building capacity to be able to measure what we do. And so there's a need for us to improve on that, training our health professionals, mental health professionals, to be able to measure, what we do. And also working with others that already, collaboration, with others that already have the capacity to do. Especially with, for instance, the universities, academia, our collaborations with that would help us measure what we do. And then when we have found the results, it should not just, gather dust,
We want it reflected in policy.
Yes, so that we actually know that, yes, we're doing this and this is the impact. It would encourage us to do more.
Okay.
And then I would also, even before I land, I would want to say that in terms of policy formulation, yes, we are responsible for policy formulation and then implementation. However, when it comes to, legislation, so for instance, it's taking so long for for even the LI to be passed, and after that, the mental health fund, yes, it's been established, but where is the fund to even sustain, if not even sustain, start, this whole thing. We want to say that we want to be at the decision-making table with whoever is in charge. I mean, legislature, the government. Yeah. We are part of government.
You don't have any seat at the ministry mental health body representing on maybe the board or the ministry to take such decisions? Do we have any mental health person?
No, I don't.
So you are not at the decision-making table?
No.
Well, a few times I'm sure you'll be consulted, but I think that there has to be some.
So what is your call?
What is my call? We should be there at every point.
We should be at the table, not on the table.
At the table, yeah.
And you think if you're at the table, a lot of things will change?
I believe so.
Okay.
I believe so.
All right. Finally, before we go, your final word to those in authority, policy shift to ensure that Ghana Psychological Association, your members get, employed, and what do you want change? 1 minute.
Yeah, I'm happy that Dr. Adodoye highlighted that there's supposed to be a very comprehensive mental health system, not only shifted towards doctors and nurses, but also psychologists and even added social workers, because it has to be holistic. Everybody has a part to play. So if we skew it, it affects the assessment you're talking about. At the Ghana Psychological Association, we took an initiative to start what we call the Ghana Mental Health Index, so that we can monitor and track some key mental health issues across the country. One of the reasons why we have not been successful with that initiative, even though it's still ongoing, again, has to do with the fact that we do not have a lot of our members across to even help with data collection.
Okay.
And that is why we are very, very keen on ensuring that really happens. Another thing too is that, and I am happy
1 minute.
Yes, she's here, that let us make it an effort to employ a number of psychologists, and then also through the fair wages, let's look at reclassifying psychologists, because they are not first degree holders. They are specialists, and they need to be compensated as such, so that we can retain the few, because the 12 that are there, or even the 19 she just mentioned, or she mentioned, I can tell you that some may even leave. So if we do not improve the system, they may leave, and then the whole thing that we are actually fighting for may not really work the way we expect it to.
Right, but the private sector is there. I mean, there are private institutions where people have mental conditions, they are stressed at work and all that.
No, you know, it's expensive to assess mental health support, even from the private. Because can you imagine somebody at Bolgatanga or WA going to assess private, going to see a psychologist? It could be expensive.
Right.
But going to the government hospitals may be less cheaper.
Okay. Final word, 30 seconds, 30 seconds.
Yes, thank you very much. So I would want to say that for us in the Ghana Health Service, we provide community mental health services as well. However, our main challenge has been that we do not have, funding to be able to support that. But you will find our community mental health officers within every district, every sub-district. I'm calling on all Ghanaians, corporate institutions, our religious bodies, philanthropists to, support us by supporting us with, means of movement, motorbikes, fuel, to be able to support
your work. Thank you.
Yes,
thank you so
very
much. Dr. Amabwedo is the Deputy DG, Ghana
Deputy Director responsible for mental health.
Mental health, as well as Dr. Eugene Dodoe, the Chief Executive Officer of Mental Health Authority, and Dr. Richmond Akwa Coman, President, Ghana Psychological Association. And you've been watching The Probe, and this is where we draw the curtain. You can log on to myjoyonline.com for more stories on mental health. My name is Carlos Caloni. Bye-bye.
Thank you.